I want to thank Dr. Glenn Jacobowitz, the president for the American Venous Forum, for agreeing to this podcast on the upcoming meeting in Tampa from March 3rd to March 6th, 2024 in Tampa, Florida. So thank you.
Well, it's my pleasure to be here, Dr. Ingarani. We're very much looking forward to the meeting this year. There's a tremendous agenda that we have for it, and I think it's really going to be a great meeting with a great scientific value as well as value for trainees and residents and APPs, both national and international. It's really a very encompassing meeting, and I'm happy to go through some of the specifics with you.
Yeah, that'd be great. So the meetings always had some of the best science in venous disease. It's really one of the top meetings worldwide. But what's new for this particular meeting?
Well, that's a good question. I mean, I think some of the things that are particularly new for this meeting are an increased emphasis on something that we started last year, which is looking at inequities in venous care. And that is really something that was presented at one of our sessions last year, which I had the pleasure and honor of sharing. And we've expanded it this year. We developed a task force on venous inequities, which is led by Misaki Kiguchi. And that's taken on several aspects. One is to look into ongoing inequities of care. And there's an entire session on that this year with scientific-based presentations to really identify the scope of the problem and to try to work on developing a call to action so we can try to overcome this problem. And as you may know, this involves not only awareness of venous disease, but recognizing it when it's present, and then having patients have access to care. And there are many, many barriers to that, whether it's geographic or access to the proper doctors, or even having primary care doctors being able to refer patients to specialists properly, or to having enough of training and understanding to administer basic care, even if it's only preventive care to patients. So that's a very important aspect of this meeting, which we have emphasized and which I wanted to be part of my presidential year. And I think we've done a great job. We have a wonderful program looking at that. So I would encourage everyone to look forward to that. And then on top of that, we have arranged our first day of service this year, which will be happening in Tampa in coordination with University of South Florida's program, who are really the host large program in Tampa, going out into the community the day before our meeting starts to promote awareness of venous disease.
So is it anybody can attend the Day of Science, or is it just for particular people who are going to be reaching out? How is that structured?
The Day of Service, we've actually structured it very much so with our colleagues at University of South Florida and members of the American Venous Forum. So we'll be going to several sites, one in the morning, one in the afternoon on Saturday, which I believe is March 1st or 2nd. So it's a very well-organized program right now. And that's one really new aspect, and we hope to continue that, from year to year in whatever location that the meeting takes place. So I
really like that idea of Day of Service. I think it's really important, and I think it'll just help highlight the importance of reaching out to the communities who are underserved or really have sometimes no access to skilled venous care. So I think that is very, very important. So congratulations.
Thanks. Yeah, I know that both you and I have seen that working in large cities, but again, it can be affected by rural areas too, or many other reasons. In fact, I hope to have a report on this. Towards the end of the meeting, we'll hopefully get some good video and reporting on how that this Day of Service went, so everyone attending the meeting can really get immediate feedback on how it went and what our immediate plans will be going forward.
You mentioned something, some section that's for the APPs. Can you expand a little bit on that? Because I think a lot of APPs would be also interested in learning some about venous care.
Yeah. In fact, this year we actually changed the days of the meeting. We're starting it on a Sunday and it's going to a Wednesday. So that first Sunday in the morning, before the initial plenary sessions, the morning and early afternoon, we have sessions really focused on APPs. Some of it is with generalized venous care, and some of it is with superficial venous care, including sclerotherapy. It's really an extensive program put together by some of our member colleagues who are nurse practitioners and PAs and are heavily involved in this kind of care, which, as you know, from a population standpoint, is these are the folks that are really the front line that are seeing many patients on a day-to-day basis from treating chronic wounds to preventive care to good compression training and understanding of the importance of compression when needed. And there's really a quite extensive program that's been put together for that in multiple sessions. So I encourage everyone to go right to the American Venous Forum website. And when you see that, you'll see the agenda for the meeting, and you can scroll right through the various components of that. And I certainly want to emphasize that also, that the agenda is posted. We've had a great job by our program committee under the chair of Dr. Arjun Jairaj and his committee, and their administrators and staff at American Venous Forum have done a great job putting that together, really months in advance, so people can look at the program in detail.
You also mentioned that there's some particular portions of the meeting for trainees. What can the trainees be doing? What can they learn? What's set up for them?
Yeah, there are physicians in training programs that'll be present at the meeting. In addition, we've had several members on our own funding to support both residents as well as medical students that have scholarships for them to attend the meeting. We'll cover some of their travel costs. In fact, several medical students are presenting at the meeting, which we're always pleased to see. We want to encourage their participation and plan to have their membership, really for years to come, because they really add a certain energy to this, and we want as many of them to come as possible. We already have had a good response to that, so we feel that it's our responsibility and duty and our pleasure to be able to support them to come to the meeting.
So can you give us a sneak peek on some of the new upcoming technologies, papers, or upcoming trials that are going to be presented?
Yeah, I can. In fact, on the last day of the meeting, we have a whole session on that. And I'll give you as much of a sneak peek as I can. There's some really fascinating talks there. There are talks on some new venous stent implants. These are primarily randomized controlled trials or large multi-center studies. There's a randomized controlled trial on the use of a non-pneumatic compression for lymphedema. There are presentation on multi-center trials on the efficacy of embolization of pelvic and ovarian veins for pelvic congestion syndrome. There will be a report on the C-tract trial for chronic disease in the iliac veins for the effective treatment on post-thrombotic syndrome. So it really runs a very wide gamut, but they're really fantastic presentations, and they are on the Wednesday, which is the last day of the meeting in the morning. But I think there will be these are really groundbreaking talks, and I really look forward to having them presented. And I think it would behoove anyone who comes to kind of hang in there to the latter parts of the meeting, because this is really going to be a particularly outstanding part of the meeting this year. I'm glad you asked that question, because this is really something that this particular year is outstanding.
It sounds like it's going to be a very dynamic meeting with some really great science and really great information, some really great networking and meeting old friends. So thank you very much for giving this podcast. It's much appreciated, and we're looking forward to the meeting.
Thank you. In fact, the motto or for this meeting is the science of veins, a world without boundaries. So I hope I've described something like that, and we look forward to seeing everyone in Tampa for what we hope to be an outstanding meeting. And I want to thank you for the opportunity to do this with you today.
Thank you.